name's Dan Chauncey, and I'm one of the co-authors of Performance Improvement for Healthcare. And what I wanted to talk to you about today was how do you bring expertise into your organization. In the book, what we've sort of coined the phrases of buy one, rent one, or grow one. And I want to address each of those sort of in kind and talk about some of the pluses, maybe minuses of each. As an example, for buying one, what we're talking about there is when you hire an advanced practitioner into your organization to help you develop your program. The area of difficulty there is, first of all, hiring a practitioner with the skill set when within the organization you may not have the appropriate skill set to do the interviewing and the hiring process. That's the first piece of the difficulty. The second is to find an individual with the right mix of skills that aligns with the strategic approach that you want to apply within your health system. Again, that's very difficult. And there are some pluses for hiring. You can jumpstart it, you can get your deployment going very quickly. An alternative to that is rent one, and that's when you bring in a consultancy, and generally it would be the same consulting group that would come in to help guide you through your deployment and do your initial training, and then they would actually provide you with some advanced practitioners who would do some processes and ensure alignment with the deployment mode that was put in place. The third one is to grow your own, and usually grow your own is done in conjunction with the rent one. And this we find is really the best for several reasons. Obviously, you're getting a very skilled group of consultants who come in, are very familiar with healthcare, and able to truly guide your deployment and start molding those people that you decide to bring up from within your organization. Obviously, by bringing people from within your organization are already aligned with your culture, and then you can slowly grow them through a partnership with the consultancy that will allow them to truly align themselves both with the culture as well as with the strategic goals of your performance improvement program, and also with the small nuances that change within everybody's deployment view. So as you do this, I think you really should consider, first of all, bringing in a consultancy. I think that's a critical piece. People who have seen multiple deployments is very critical. Normally when you hire someone from external, you'll hire them in from another health system, and they may have only been exposed to one. So let's assume that you do bring in a consultancy, and then allow the consultant to help you either hire from within or do the interview process and orientation from those external to your organization. Either of those are workable, but remember, anytime you can move people up your organization and bring them to positions of more and more responsibility, that's a definite plus for your organization, well beyond the scope of performance improvement.